In this video, you will learn the common side effects and adverse effects of furosemide. Before we start, check the description below for free sources to help you become a nurse and pass nursing exams on your first try. Also, stay at the end of the video to complete a 3-question quiz to test what you learned at the end of the video. Let's begin. As we remember in the previous lesson, furosemide is an effective diuretic for treating fluid retention, which is typically well tolerated. But, like all medications, it has the potential to have negative reactions and side effects. To ensure the safe use of furosemide, it is crucial to be informed of these possible side effects. Here are some common side effects and adverse reactions associated with furosemide. First, let's go over common side effects. Increased urination. Furosemide is a diuretic that promotes urine production. As a result, increased urination is a common side effect. This effect is expected and usually not cause for concern. However, if it becomes excessive or is accompanied by other concerning symptoms, it is important to consult a healthcare professional. Electrolyte imbalances. Furosemide can cause imbalances in electrolyte levels, such as low potassium, hypokalemia, low sodium, hyponatremia, and low magnesium, hypomagnesemia. These imbalances can lead to symptoms such as muscle cramps, weakness, irregular heartbeat, and fatigue. Regular monitoring of electrolyte levels and appropriate supplementation may be necessary. Dizziness and lightheadedness. Furosemide can cause dizziness or lightheadedness, especially when standing up quickly. It is important to rise slowly from a seated or lying position to minimize the risk of falls or injury. Low blood pressure. Furosemide can lower blood pressure, leading to symptoms such as dizziness, fainting, or feeling lightheaded. Monitoring of blood pressure is important, especially in individuals with pre-existing low blood pressure. Headache. Some individuals may experience headaches as a side effect of furosemide. These headaches are generally mild and resolve on their own. If persistent or severe, it is advisable to consult a healthcare professional. Now let's go over adverse reactions associated with furosemide. Allergic reactions. Allergic responses to furosemide can happen, however they are uncommon. Skin rash, itching, swelling, extreme vertigo, or breathing difficulties are possible symptoms. You should get emergency medical help if you encounter any allergic reaction symptoms. Aplastic anemia. The rare but deadly disorder known as aplastic anemia is characterized by a reduction in the synthesis of platelets, white blood cells, and red blood cells in the bone marrow. Although extremely rare, furosemide has been reported to be associated with the development of aplastic anemia. Ototoxicity. Furosemide can harm the inner ear and result in hearing loss or ringing in the ears, especially when given in high dosages or quickly infused intravenously. Any changes in hearing must be reported right away. Hypersensitivity reactions. Furosemide hypersensitivity reactions, which might manifest as fever, skin rash, joint pain, or general malaise in some people, are possible. The medication may need to be stopped because of these reactions, which call for a medical evaluation. A rare skin condition called erythema multiforme is characterized by the emergence of a bull's-eye, or target-shaped skin lesions. Immune reactions to infections or medicines, such as furosemide, frequently set it off. EM symptoms might include a red, patchy rash on the skin, target-shaped lesions with a red center and a ring around it, itching or burning, and, in more severe cases, blisters or ulcerations. Stevens-Johnson syndrome and toxic epidermal necrolysis. Some drugs, including furosemide, can result in the serious and sometimes fatal skin disorders Stevens-Johnson syndrome and toxic epidermal necrolysis. They are regarded as uncommon but may have severe adverse effects. Stevens-Johnson syndrome and toxic epidermal necrolysis symptoms might include a painful skin rash that develops quickly, blistering or peeling of the skin, involvement of mucous membrane changes, fever and flu-like symptoms, as well as excruciating skin pain and discomfort. Pancreatitis. Furosemide has been linked, although infrequently, to pancreatitis, which is the inflammation of the pancreas. Severe stomach discomfort, nausea, and vomiting are possible symptoms. If pancreatitis is thought to be present, immediate medical intervention is required. Agranulocytosis. A severe illness called agranulocytosis is characterized by a sharp decline of granulocytes, a type of white blood cell. Agranulocytosis has been linked to furosemide, but rarely. Mini quiz. From here, you will answer 3 questions to reinforce your learning. Starting with the first question. What are at least 3 common side effects of furosemide? Pause here while you write down your answers. Common side effects are increased urination, electrolyte imbalances, dizziness and lightheadedness, low blood pressure and headache. Next question. True or false? Furosemide cannot harm the inner ear and result in hearing loss or ringing in the ears. The answer is false. It can harm the inner ear, causing ototoxicity. Next. Fill in the blank. A severe illness called blank is characterized by a sharp decline of granulocytes, a type of white blood cell. The correct answer is agranulocytosis. In the next video, you will learn the nursing assessment of furosemide. If you enjoyed this video, please like and subscribe for more. Thanks for watching.